Well, students are returning to college campuses all across the state of Arkansas. I caught up with Dr. Houston Davis, president of the University of Central Arkansas, to find out how he plans to tackle the COVID-19 crisis in another school year. Well, Dr. Davis, about this time last year, you and I were sitting down talking about the COVID-19 crisis and how your campus was preparing for students returning to campus in a safe environment. Tell me what you are doing today in terms of putting protocols in place to safety in place for the students that are returning to campus.
Yeah, I think that a lot of people have a little sense of deja vu at this point this year. But I'll tell you one thing that we know is that we know much more this year than this time last year. There were so many mysteries about what was in front of us but as we look forward to things like our testing and tracing operation, which was very successful in allowing us to see the entirety of last school year through, we never closed down at any point. We have those processes still in place. We'll still be providing quarantine and isolation space for our students or faculty or staff that need it. But by all means, if someone needs to be served by the university in that way, we'll make certain that they've got a place to be able to do their quarantine and isolation. But the biggest thing that we're doing this year is we're really just placing a premium on normalizing the vaccine. We want to make certain that as many of our faculty, staff, and students have that as possible, because this virus is really ravaging communities, especially those that are unvaccinated. So that's our big full court press at this point, is making certain to impress upon individuals how important the vaccine is and how that in the end is keeping you safe from the worst of this virus.
Controversially, you have reinstated a mask mandate on campus, as have a lot of other colleges and universities, as well as some K through 12 schools. Tell me what the reaction has been to that initiative, that policy.
Certainly. Well, overwhelmingly positive, and I'm very glad to be able to say that. We're now 2 days removed from putting that out to our students, faculty, and staff, and then putting that out to social media. There certainly have been negative reactions. There are some people that have reacted, I hate wearing these masks. Well, guess what? I hate wearing the mask too. I don't know that anybody really enjoys having to do that, but when we're in periods of community spread, such as we are now, I very much have appreciated the support that our board has provided and the support of our general campus, that this is something that we need to do. At least as we look forward to the first few weeks of the fall semester, we're asking everyone to be good with this, because in the end, that is what is going to allow us to get off to a good start with our fall semester. No one wants to have to go remote. No one wants to not be able to have classes meet in person, and no one wants to have any of our residence hall operations have to be shut down. So we will expect everyone to wear masks when we're in a substantial risk or high risk period, and the state of Arkansas generally is in a high risk now. But I can tell you that the response to that has been positive, and we're really excited about being able to start our fall semester with that added layer of protection in place.
You had a system in place last year for quarantining students if they were diagnosed with COVID-19. You basically had a dormitory that was isolated for them to convalesce in. Is that still your plan today, A? And B, if your resources get exhausted, what is your plan B?
Yeah, I don't know that you recall last year, I think I described for you a system where we had taken an entire residence hall, Carmichael Hall, and then houses around campus. And we actually had 229 units available to us for quarantine and isolation purposes as we did last year. At no point last year did we need more than 40 of those units in any given day or stretch of days. So we feel very good about the fact that as we start this fall semester, we presently have 65 quarantine and isolation spaces that are presently set and ready, and then we've got the ability to flex out to around 100 if we need to. We think that that's going to be plenty for what we'll experience, because again, we have the last 15 months of experience behind us. But by all means, we're going to make certain that if a student needs to do their quarantine and isolation on the UCA campus and through UCA, we're going to make certain that they can do that, because in the end, we want them to be able to continue their studies. We want them to be able to make certain that they've got the necessary health care around them. And our medical doctor, Dr. Randy Pastor, and his team at our Student Health Center, they can absolutely make sure to check on those students on a regular basis throughout those days and get them back into the classroom, into their normal pattern.
Is there any tipping point out there that you see where you may have to go back to virtual classes again?
You know, as we look to our operations on campus, I don't know that we'll reach one of those tipping points. This time last year, I think I described to you that testing was going to be everything. We felt like the number one tipping point would be is if we ever had a period of time where we were longer than 48 hours getting test results back. And Roby, I can tell you at no point last year did we reach that. We actually stayed at a day or less for 52 consecutive weeks as we look back through last year. This year, we feel very good about testing turnaround time. We certainly have the rapid tests to be able to confirm someone's positivity. We know that we can handle the quarantine and isolation. We know that we've got the tracing operation. We continue to have our testing and tracing consortium that UCA is doing in partnership with Hendrix and CBC and Conway Regional Health System. Those things that we manage and control on our campus, we feel very confident of. If I had to say anything that will be something that we'll watch, that we more as citizens of our community will have to attend to, is if the hospitals and the ability of the healthcare system in the Conway area were to really be overwhelmed where they could not manage the situation, we certainly would come to the table and respond, and that might put us in a period where we might decide that we're going to go remote for a very short period of time. But I will say this, I know that those advisors presently want us, once we get our bubble put back together, we talk about our bubble of the campus frequently, they would like us to not break our bubble and not have extended periods of time. So we're intending to stay with our operation. Again, being able to do masks will allow us to be able to stay in a normal operation. We hope that that is able to hold for as long as it needs to into this fall semester.
So shifting gears, pre-pandemic, I think I was on your campus for the groundbreaking of a health sciences building that you guys were building. That building is now open. Tell me what you think, particularly in the context of the pandemic. What do you think is the need for more people in the health sciences now, and how that building and what goes on in that building is going to be a part of that?
Well, I think the need for our integrated health sciences building has probably never been greater. Pre-pandemic, it really was about the educational and the economic development needs of that building. It was really about responding to healthcare shortages, especially those of us producing more nurses, admitting more students into our nursing program and graduating more, but also everything that's touched by our College of Health and Behavioral Sciences. But during the pandemic, and as we're in the during part, if you will, I think it's even more important that we make certain that we're thinking about the health needs of the state of Arkansas. Our UCA campaign is UCA Now, Impact Arkansas and Beyond. It really is about what are we doing to face some of the great challenges that our state does, and making certain that we're producing the healthcare professionals that can go and meet the very real and urgent needs of our communities. Our Integrated Health Sciences building will open up. Our grand opening is this Friday. Our faculty and our students have already moved in and they're getting ready for the fall semester to begin. But we're excited. It's 80,000 square feet across all of our programs in the health sciences. It's going to allow us to almost double the number of admittances into those programs. It's going to be a difference maker. It will move the needle for the state of Arkansas, and the University of Central Arkansas is proud to have that new facility on our campus.
Well, I have not stepped foot on the UCA campus in some time, thanks to the pandemic primarily. But tell me, what else is going on the UCA campus that you think the public ought to be aware of?
Well, for one thing, I think that I'm very proud of our faculty and staff and students during the last year. We never stopped. One thing that was very critical back in March of 2020, we realized that we needed to be there for our public that needed us most. And that meant not stepping away from core mission of serving students that needed us, making certain that we were still attending to student success, and making certain that all of our students were continuing to make progress toward a degree. That has allowed us to not just have the pandemic be our sole focus. I think that our provost, Patty Poulter, and I were stepping back and reflecting upon the year that was, and we were probably 11, 12 accomplishments deep into the list before we got to any brag points about how we faced the pandemic. Very excited about how we were able to bring in our freshman class last year, and excited about our retention of that group. Excited about the fact that we've had, goodness, almost 2,300 students to graduate from UCA in the last year. Excited about the fact that we did not stop with the building of the Integrated Health Sciences building. We kept moving forward with the groundbreaking and and it's under construction, the Wingate Center for Fine and Performing Arts. We've continued focusing on where can we refresh residence halls to make certain that those buildings are prepared for a great future. So it's been a year of movement. It's been a year of progress, and I'm proud of that because I certainly know from other presidents and chancellors around the country, this has been a year of time out for a lot of higher education, and we just felt like we could not stop. I'm a big believer that sometimes if you shut down an engine, you never know if it will start back up, and I think that people and organizations are the same way. So we focused on being able to attend to our students their greatest levels of needs during this pandemic, and that allowed us to continue fulfilling our broader mission. It's a campus that stays on the move, and again, that's a tribute to our faculty, our staff, and our students. Their resilience and their energy and their positive commitment to not only the president but making certain to leave UCA better than they found it. That's a blessing to be president of a university that takes on that type of culture.